So today, we're going to unpack one of the most urgent questions that came out of the pandemic. How do you figure out which COVID-19 patients are going to get seriously ill and which ones won't? When hospitals were absolutely pushed to the brink, this question became, quite literally, a matter of life and death.
I mean, just try to picture this scene. It is the absolute peak of the pandemic, your hospital is overflowing, and you have one single ICU bed left. 2 patients desperately need it. How on earth do you choose? And look, this wasn't some hypothetical thought experiment. This was the brutal, day-to-day reality for doctors all over the world. A high-stakes decision with unbelievable consequences.
All right, so first up, a pandemic crisis overwhelmed hospitals. To really get why this AI solution was so important, you first have to remember just how bad things were. The early days of the pandemic put a kind of strain on our healthcare system that was just unprecedented. 310,000. Let that number sink in for a second. According to the CDC, that's the estimated number of COVID-19 hospitalizations in the US in just 3.5 months of 2020. The sheer volume of sick patients was just staggering.
And this quote, which comes directly from the research paper we're looking at, it just paints such a vivid picture of a system that is in full-on emergency mode. Hospitals weren't just busy, they were completely reorganizing themselves on the fly, basically turning into dedicated COVID-19 battle stations.
So right in the middle of all this chaos, a group of researchers at 5 major hospitals in Massachusetts decided they needed a better tool. They didn't want to just manage the crisis, they wanted to get ahead of it.
This was the core question they were trying to answer. Could they build some kind of early warning system? By digging into the data from over 2,500 COVID-positive patients, they wanted to know if they could look at someone's chart right when they came in and accurately predict if they need an ICU bed or a ventilator days later, long before their condition got visibly worse.
So how on earth do you build a medical crystal ball? Well, you don't. You build something way more powerful, a machine learning model. And this is where we meet our AI detective. You know, the concept is actually pretty intuitive. You basically feed the AI thousands and thousands of anonymous patient files. Some of these patients got very sick, and some of them didn't. And then you just tell the AI, go find the patterns. Find the hidden clues that separate these 2 groups. The machine then sifts through way more data than any human ever could to find all these subtle connections.
So here's a quick look at how they actually did it. First, of course, you gather the data. In this case, records from 2,566 patients. Then, from each of those files, they pulled out 164 potential clues. And this is everything from vital signs and lab results to age and other health conditions. And finally, they let their AI detective loose on this mountain of evidence to build the actual predictive models.
So what did this AI detective actually find? Well, it wasn't just a random list of risk factors. It was more like a distinct fingerprint, what the researchers started calling a signature for severe COVID-19.
And this is really important. It wasn't just one single signature for everyone. The AI was actually smart enough to find different sets of clues for different outcomes. It's like it had one signature for, this person will probably need to be hospitalized, and a different, much more serious one for, this person is likely headed to the ICU.
So for that first step, just predicting who would need to be admitted to the hospital at all, the AI focused on these factors. And you know, they're things that make a lot of intuitive sense, right? Abnormal vitals like low oxygen, being older, having a higher BMI, and shortness of breath. These were the initial red flags.
But, and this is the really key part, for the most severe outcomes, like needing an ICU bed or a ventilator, the signature looked different. Here, the AI was flagging things like cloudiness on a chest scan, being male, having diabetes, and crucially, very specific lab results, like elevated LVH, which is a marker for tissue damage.
Okay, so the AI found these patterns, which is fascinating stuff. But the big question is, did it actually work? How well did it perform compared to the tools doctors were already using? It's time to put the models to the test.
Well, you have to remember, the existing tools, things like the Pneumonia Severity Index, they were designed for general pneumonia, not this brand new, totally unique virus. The new AI models, though, they were custom-built, trained specifically on thousands of COVID-19 patient files, and that made a huge difference. And boom, here's the proof. When it came to predicting who would end up in the ICU, the old scoring system was about 73% accurate. Pretty good. But the new AI model, a stunning 87% accurate. Now that 14-point jump might not sound like a lot, but in a hospital, that is a massive, massive leap in a doctor's ability to see what's coming.
But let's make this real, because numbers are one thing, people are another. This case study from the paper tells the entire story. A 51-year-old man comes in. For 3 whole days, he seems stable. He's doing fine on the regular ward. But the AI, just by looking at his initial data, specifically his high LDH level and his diabetes, had already flagged him as high risk. And sure enough, just as the model predicted, he ended up in the ICU.
And this wasn't just a one-off, a lucky guess. Here's another case. A 59-year-old man looked stable for 2 days. But again, the model saw the danger signs hidden in his initial blood work. On day 3, he had to be intubated. The AI saw what the human eye just couldn't perceive yet.
So what's the big takeaway from all of this? Why does it matter? Well, this research isn't just some academic exercise. It represents a huge shift from being reactive to being proactive. It's about turning prediction into powerful, life-saving action.
I mean, the real-world applications here are huge. First, it helps doctors on the ground know which patients might seem okay, but really need to be watched like a hawk. Second, it lets hospitals look at their incoming patients and better guess how many ICU beds and staff they're going to need. And finally, on a much bigger scale, it can help inform public health policy, like who should be prioritized for things like vaccines or treatments.
What this research really gives us is a powerful peek into the future of medicine. By harnessing the power of AI to see these invisible patterns in a disease, we can be so much better prepared. And it really leaves us with a critical question to think about. When the next pandemic arrives, how will tools like this change the story for all of us?